Out of all of them, we have two answer choices, our 50 S's. Clinda and Azithro. Do you agree? Clinda and one of the three, Azithros. There's Azithro, Clarithro, Erythro. Okay, watch. Which one of you, let's take out this and this now. Which one of you is going to call AMBOSS and say, hey guys, hey AMBOSS, psst, you made a big mistake. Why? Well, on this question, you have two answer choices. Which one are you guys going to call them, right? Be careful, there's a trick. So we were able to eliminate all but two. Yes? Yes. Now you might say, come on, man, I know this. This isn't, I hope you realize it's not just me and you, it's me and the world, right? All of you guys plus people watching later. So you have to understand this is the same for antivirals, same for antiarrhythmics, anticholinergics, anti-epileptics, antithyrotics, you name it, okay? If you're not doing this, you have a long way to go when it comes to these kind of points. So this farm technique is not just for this drug, it's for all the drugs in USMLE. Okay, so we're down to two. Now we have to go to the first part of the scenario. A 51-year-old man, alcohol use disorder, comes to us, fever, productive cough. X-ray shows right lower lobe consolidation. They give you the stupid diagnosis. Diagnosis is aspiration pneumo. This is nice. Now, what if they didn't give us aspiration pneumo, but it's supposed to be aspiration pneumo? Do we know what other symptoms will tell us it's aspiration pneumo? Well, it could be alcoholic or alcohol use disorder. It could be Parkinson's, multiple sclerosis, any esophageal problems. It could be somebody who is bedridden, who's been surgery in the bed for weeks. Yeah. Anything with esophageal dysmotility, sure, meaning risk of aspiration. Also, what else can we think about aspiration pneumo? Oh, anaerobic infections, aspiration pneumo, meaning really bad cough, really bad sputum. It smells really bad, right? Malodorous, foul smelling. So these are the words, the terms that we get comfortable when they ask on the exam. But in this case, they gave you aspiration pneumo. Boom. That's kind of cool. All right. So now, unfortunately, if you're able to eliminate all of these because of the little mnemonic, buy a 30, sell a 50, we will guarantee that we're able to eliminate all but two. That's fair. Now, my friends, how will you answer the question? We have to know which one of these is used for anaerobic infections. And we have to know that it's this one. That's all, clindamycin. You just have to know that clindamycin, even though both are inhibiting 50S, this clindamycin is used for anaerobic infections. Typically, if you have aspiration pneumo, lung abscesses, you just need to know this. And that's why it's hard, Step, for this reason. They tease you. You get so close to the answer. They're like, wow, man, 50-50. Okay, no problem. Learn it. Because this one here, azithromycin, 35% went to this one. It also inhibits 50S, but it's used for CAP, community-acquired pneumonia. It is not effective against anaerobics, guys. So I'm sorry to say, but medicine is not difficult, especially pharm. It's challenging to do, but it's kind of like, if I put the effort in, I want to get 10 back. If I give you, I used to use this example. If you gave me $20, I give you back 100. You think I'm crazy. You think, what's going on? Why is this guy giving me money? It's the same concept here. A lot of you are just putting in 20, getting back 20. You give me 20, I give you back 100 with my techniques, which means now when you go over the stupid question, because this test I don't like, I'm pushing you guys hard to pass this test, right? It's a game. It's not, medicine is medicine. Hospital is hospital. This is a game you have to play. Think that way.